and that we think about the public that flies as individuals, not necessarily is it United, is it U.S. Air, is it American, is it whatever. It's the question, can we get them to where they want to go? I yield the floor.
Would the senator from Washington allow me to just make a couple of minutes response to the senator from West Virginia?
I would, sure.
Thank you. Madam President, let me just say I appreciate so much what the chairman has just said. I think that is a major statement because what he says is true. One flight from Washington National to California, that is all we have, one direct flight. That is not fair. It is not fair to the people in the West, certainly in the largest state in America, California, in population. And I hope that what you have said will lead us, Mr. Chairman, to a table to negotiate this so that we can be fair to the entire western half of the United States, so that we are also taking into account the people who live in and around the Washington metropolitan area, which is what I think the western senators have tried to do. But let's talk about it. Let's get something on the floor. Let's negotiate this because with that, this is a bill that, with a few tweaks perhaps, but this is a bill that ought to pass for the right reasons for our country and for the traveling public. Thank you, Mr. Chairman, for that leadership, and thank you, Senator Murray.
Madam President.
Senator from Washington.
Thank you, Madam President. We are here today to be debating the FAA reauthorization bill, a very important piece of legislation. Will create thousands of jobs and put in place the ability for us to have the infrastructure to make sure that we are competitive in the future. So it is disheartening to me that this bill has now been hijacked by a political debate, an amendment to repeal the health care reform. Not every bill has to become political, but unfortunately that's what we have today because we have an offer of an amendment to repeal health care reform. So let me speak to that amendment. You know, last year I watched as President Obama signed health care reform into law with a young man by the name of Marcellus Owens. He stood just a few feet away from the president. I had met Marcellus a few months earlier at a rally in Seattle, and he told me a story that stayed with me throughout the entire health care debate. It was a story I told here on the Senate floor, and I want to mention it again. Marcellus came up to me at this health care rally, little boy. He leaned in close to me and he said he wanted to tell me about his mom named Tiffany. She was a single mom, working hard, got sick, lost her job. Because she lost her job, she lost her health care. Because she lost her health care, she lost her life. And little Marcellus looked up at me and he said, please don't let this happen to any other little boy. Please pass health care. Well, I was proud when that health care reform law was passed and is now working to make sure that Marcellus and thousands of other little kids don't get into that terrible situation that he's lived through. He wasn't alone. I heard from thousands of people from my home state of Washington who were demanding reform to the system that we had. I heard from small business owners who wanted to cover their employees, but they could not continue to do it because of the skyrocketing premiums. I heard from moms and dads who wanted to cover their children, but they were getting rejected because their son or daughter had a pre-existing condition. I heard from seniors who were desperate because they had fallen into the donut hole. They didn't know how they were going to afford the drugs that they needed to take so that they could have dignity of life in their senior years. I heard from men and women in every part of my state, some barely holding on to their health insurance, and a lot with no coverage at all. And each one of their stories had a common thread. The health care system we have in this country today didn't work for them. It failed their families one way or another, and they wanted it to change. So, Madam President, that is why I fought so hard with so many of my colleagues to reform that broken health insurance system, to fight for our families who needed help and were desperate, and to level the playing field for people who needed a little bit of support. We got that done for our families, and we can never go back. We cannot go back to a time when millions of Americans stayed up at night worrying about what would happen to them and their families if they lost their job and their health insurance. when insurance companies put unreasonable and unfair lifetime caps on coverage for our families, when women weren't able to get equal access to coverage, when small businesses couldn't afford health care, and when so many seniors who couldn't afford it had to pay the full cost of expensive medications. We cannot go back to that. So, Madam President, my question for Republicans today is, why would they want us to? The changes that we made insurance companies be required to cover preventive services with little or no cost sharing on the part of patients. It gives families access to new, streamlined assistance to help them appeal services that they've been denied or not covered adequate care for, something that so many families got lost in prior to passage of this legislation. It helps anyone who's ever been buried under a blizzard of forms from their insurance company and denials for coverage that they need to have. It helps our small businesses afford care for themselves and their employees who are now getting a tax deduction as they fill out their forms and going, I didn't know this was in health care bill, and we're going to vote to take that away? Madam President, I ask, why do Republicans want to take away the benefits as part of the business of the Senate as we just get started to get our economy back on track? In my home state of Washington, the Republicans' plan would mean nearly 900,000 seniors who have Medicare coverage will be forced to pay now more for regular checkups and important preventive services. It would mean they lose out on the 50% discounts on some of their prescription drugs. And it would mean that insurance companies would no longer now be required to allow people to stay on their policies until they're 26. And that, by the way, is going to be especially harmful now when so many of those young people today are having trouble finding a job. So, Madam President, our families are depending on the changes that we made within this health care reform law. It's why I supported reforming our health care system. It's why I fought so hard here for so long to make sure it worked for our families and small business owners. And it's why I'm going to keep fighting to make sure that we don't go back to the way things were, that we continue to make progress and do this right. I'm happy to work with anyone, Democrat or Republican, to improve this law. But I will do everything I can to fight a full repeal that will devastate our families and small business owners across America. And I urge my colleagues to vote no against this full repeal of health care reform. And one final point. We hear so many people talking about the deficit today and how important it is that we get our hands around the budget and our budget deficit. So it's astonishing to me that this First Amendment that's brought by the Republicans will cost our federal government $1.5 trillion and put us deeper into a deficit hole. Madam President, progress is important. Getting our families back on track is important. Making sure that our economy is moving within the FAA bill that we're talking about on the floor is important. And it is important that we continue to make sure the health care insurance reform system we put in place works for our families. And that's what I will be voting on later today. Thank you, Madam President. I yield the floor.
Madam President.
Senator from Arizona.
Madam President, yesterday I spoke on one of the reasons for the repeal of this legislation, that is to say the support for the amendment to repeal the health care legislation that is pending before us. And today I'd like to speak about a couple of other reasons to support that amendment. One of the things that was said in the campaign to pass the health care bill was that those who liked their current health care would be able to keep it. But as we know now, and as we pointed out prior to the bill's passage, provisions of the law would cause many Americans and will cause many Americans to lose their coverage. And that's why the administration is now giving out waivers for some of the bill's most burdensome provisions. And I would like to speak just for a moment here about these waivers that the administration has granted and the problems that the waivers reveal with the bill as a whole. So far, the administration has granted 729 waivers. All of these are temporary. They protect companies and labor unions from one of the bill's most onerous mandates, the phasing out of annual caps on costs paid by insurers. Another 4 waivers were granted to states applying on behalf of insurers. According to the administration, waivers may be granted if the applicant can show that a large increase in premiums or a significant decrease in access to coverage would occur absent a waiver. So far, the waivers cover 2,283,106 people. That's more than 2 million people that the administration has had to protect from its own bill. All of these waivers were granted to limit benefit plans, or so-called mini-med plans. About 1.4 million Americans have these mini-med plans, including many part-time employees who work in the restaurant and retail industries. These plans are low cost and usually have an annual cap on the costs the insurer will pay out. Under Obamacare, these plans would be outlawed. A phase-out on annual caps begins this year. So starting this year, plans cannot impose an annual limit of less than $750,000, and that threshold gets progressively higher until 2014, when Obamacare will prohibit annual caps altogether. What this does, of course, is to create an incentive for employers who currently offer mini-med plans below the new $750,000 threshold to drop their coverage completely until the employer mandate and penalties become effective in 2014. They can then either comply with the requirements of the health care law or pay a fine for each employee. Well, the employees caught in this mess who currently have coverage through mini-med plans will just have to hope that in the meantime their employer can get a waiver. Otherwise, those employees will have to wait until 2014 to buy a government-approved policy from the new insurance exchanges or hope that their employer is in compliance with the many employer requirements in the bill. McDonald's, for example, which offers mini-med plans to many of its employees, received a one-year waiver. The company warned that absent a waiver, 30,000 employees could lose their current coverage and would be left without affordable, comparably designed alternative until 2014. It's not clear what will happen when the one-year waiver expires. That's another part of the problem. The waivers are often given on the condition that the recipient brings itself into compliance during the waiver period. Whether the waiver renewals are available is unclear. As with many other provisions of Obamacare, the uncertainty for businesses surrounding annual cap waivers is immense. While the waivers are welcomed by those who benefit, they represent a poor way to run the government or health care. When the government picks which entities will have to abide by the law and which ones won't, it's literally picking winners and losers. That's not the recipe for objective or wise policymaking. It's called discrimination. I'll note that a large number of these waivers were being given out to the administration's political allies. Unions, for example, many of whom praised the bill's passage, are a major beneficiary. Of the 733 waivers granted, 182 went to unions. That's a quarter of all the waivers, even though unionized workers make up only 7% of the private workforce. Many of the unions applying for waivers are the very same who were full of praise upon passage of Obamacare. In its press release praising passage of the bill, the Service Employees International Union gushed that it's a new day. About 6 months later, Local 25 SEIU applied for a waiver from the annual limits limitation for 31,000 of its members. It was granted 2 weeks later. Apparently it's a new day, but just not for 31,000 of the SEIU members. Similarly, when the bill was enacted, the American Federation of Teachers referred to it as an occasion where morality trumped greed. 6 months later, its New York affiliate obtained a waiver affecting 351,000 individuals. In a recent column in Forbes magazine, law professor Richard Epstein explains the dangers of administrative discretion related to waivers and how the waiver process can undermine the rule of law. And I want to quote this. Waivers are by definition an exercise of administrative discretion that benefits the party who receives its special dispensation. Nothing in Obamacare explains who should receive these waivers or why. The dangers from this uncertainty are enormous. Without major steps to overhaul or repeal Obamacare, government by waiver will become standard operating procedure to the detriment of us all. End of quotation. Madam President, this bill that was written behind closed doors creates a huge uncertainty and problems for job-creating businesses and their employees. And now waivers are being dispensed by the administration to protect almost 2.3 million people from the very law that it fought so hard to get passed. This is yet one more confirmation that the law is deeply flawed and one more reason why it should be repealed in its entirety. Now, the second thing I'd like to speak to, Madam President, is the fact that under this law there are substantial increased costs, but they are being masked by the way that the bill has been written and the calculations, therefore, that some have suggested would actually result in a savings of $230 billion. This is only plausible if you believe that the way that this bill was written was an honest way of stating its cost. It's not that the Congressional Budget Office has done anything wrong in its calculations. It's that it was told how to calculate certain things. So the bill's authors said, never mind what reality or truth is here's how you're going to calculate the costs of it, and CBO, as a functionary, did exactly that to come up with the number. But as former CBO Director Doug Holtz-Eakin recently wrote in an article along with Joe Antos and James Caparetta, explaining that the bill's purported deficit reduction is based on budget gimmicks, deceptive accounting, an implausible assumption used to create the false impression of fiscal discipline. The fact is that repeal will not add to the deficit. The bill itself is the budget buster, not repeal. Madam President, what I'd like to do is to insert in the congressional record at this point the remainder of my comments, which go through four basic assumptions that were built into the legislation as the way it was drafted, which theoretically demonstrate a savings of money through the adoption of the legislation, but which, as the authors point out, actually result in not a savings, but rather an increase in the federal budget deficit. One of these has to do with the fact that taxes are collected for 10 years, but costs only accrue over 6. Obviously, you're going to get some money that way, but after that first 6 years, you have to count the costs as well as the revenue you take in. Another is the inclusion of the so-called Class Act, which has been described by some as a Ponzi scheme, actually by the chairman of the Senate Budget Committee, because it collects all of the money up front and doesn't pay out any benefits. Well, once you have to pay out benefits, there's going to be a cost. Well, that's certainly a way to show that you're taking in money and you're not spending it, but it's a dishonest way to write the bill. Third are the way that the costs of Medicare were calculated. The so-called $500 billion savings is not really a savings at all, but rather goes to pay for other parts of the bill. It doesn't help Medicare at all. And it only works if, as the Budget Office said, Congress actually follows up with the costs, with the cuts rather, to hospitals and physicians, which nobody believed Congress would have the courage to do. And finally, there are the subsidies and exchanges calculations, which, as I point out in these comments, are woefully understated, as a result of which it is likely that we will have a significant budget deficit rather than savings as a result of this legislation. So repeal of the bill is not going to save taxpayer money. In fact, repeal of the bill is going to save taxpayer money. The legislation itself is what costs money. Just think about this in conclusion. How can you cover an additional 30 million people, or however many are allegedly going to be covered by this, without increasing costs? It can't be done, and it wouldn't be done under this legislation. So, Madam President, in addition to the reason that I talked about yesterday, the costs of Medicaid to the states, and the 2 points here today, the fact that these waivers are being granted in a discriminatory way and only demonstrates that the underlying bill is not a good idea, and that the cost calculations are way off, I hope that my colleagues will take this opportunity to follow the advice of the American people and vote to repeal Obamacare.
Madam President.
Senator from Montana.
Madam President, we unfortunately are in a period where we're going to be re-debating health care reform. We had long debates on health care reform in the last couple of years. I cannot think of legislation that occupied so much time in this body. as well as the other body. But regrettably, we are going to redebate health care reform, even though legislation was passed last year, even though legislation was signed by the President. The law is enacted. Nevertheless, this body, regrettably, is going to spend, it looks like, a lot of time redebating health care reform. Why? Basically because the other side of the aisle wants to do so. It wants to not admit that health care reform is the law of the land. It wants to repeal it. Now, the other side knows that there are not sufficient votes to repeal health care reform. That is a well-known fact. Well-known fact. The other side knows, those who cover the health care reform debate know that the votes are not there to repeal health care reform. It is the law of the land. It was signed last year, and it will remain the law of the land. So then you might ask, Madam President, if it's the law of the land today, and if everybody knows that Congress will not repeal health care reform, why in the world are we why are we debating this for another, who knows how many weeks, months, or maybe even years? To be honest, I think it's because the other side thinks, I'll take the charitable explanation first, because they don't like it. They don't like health care reform for whatever reasons, even though I strongly disagree with their reasons. But in addition to that, they think it's a political issue. They think they can score political points by harboring up or mentioning points which in the main are not accurate, but say them anyway, even though they're inaccurate points. Say it over and over and over again, unless those points are refuted, unless those myths are busted. Many American people will start to believe some of that stuff. Then there's another reason, which is a bit regrettable, and that is because there have been suits filed in federal district courts around the country alleging that the law, health care law, is unconstitutional, and it looks like that those decisions will eventually make their way up to the Supreme Court of the United States, and I suspect the Supreme Court will not rule for, I don't know, maybe a year, which means that we'll be debating health care reform, waiting to see the outcome of the United States Supreme Court. Now, I heard one, I think, very ill-advised argument just a few minutes ago. The argument is because the Supreme Court has not yet decided on the constitution of health care reform that we should, in effect, pass a moratorium, that we should forget the provisions of the law because we don't know how the court's going to rule. Madam President, that is one of the most specious and inadvisable arguments I've heard in a long, long time, because that, in effect, means that whenever any law is passed, if there's a lawsuit filed, that Congress doesn't, the law is invalid. Just because a lawsuit's filed, the law is invalid. Well, if we're to follow that line of reasoning, then any time we enact a law, anybody who doesn't like it can rush out and file a lawsuit. And that would mean that we don't follow the law. I think the better course, by far, is to assume that the law is effective. It is the law of the land, if and until it's overturned either on a statutory basis or on a constitutional basis. That's only the way we should operate. So the senator on the other side of the aisle, who suggested about half an hour ago that we should enact a moratorium, in effect, I think should rethink her position. She should, because if she's really if she really wants that to be the precedent, then I think she recognized that not too soon a period of time we'd be the country couldn't function. It really couldn't function because anybody would file a lawsuit on anything maybe passed 10 years ago. Say a law passed 10 years ago. Well, I don't like that law, so I'm going to file a lawsuit. Oh, following the senator's line of reasoning, well, we can't enforce that law because somebody doesn't like it. It makes no sense. Now, one of the myths here that has been said many times, it was just said by the previous speaker, his argument for repeal of health care reform is his statement that repeal will save money. He thinks the health care bill adds to the deficit. Now, Madam President, you and I have been around here long enough. We've lived life long enough that anybody can come up with any set of figures or statistics that he or she wants to. It's just a fact of life. And so if somebody asserts this and somebody asserts that, I think it's wise to see what's that person's authority. Who says that? Where does that come from? Who verifies that? Who validates that? Well, Madam President, as we well know, there is one organization which has studied health care reform, and it has concluded that health care reform saves, I think it's about $240 billion, reduces the deficit by $240-some billion in the first 10 years, and actually reduces the deficit by about I've forgotten exactly, but north of $1 trillion in the next 10 years. That is the Congressional Budget Office. The Congressional Budget Office, to remind my colleagues and for anyone listening, is a nonpartisan, it's a professional organization that analyzes legislation for both Republicans and Democrats and for the House and for the Senate. They're a very professional outfit. They work very, very hard. No one has ever even hinted that this outfit, the Congressional Budget Office, is unprofessional or that has a partisan bias. Nobody's even suggested that. Everybody knows it. They work very, very hard, and they do the very best they can under difficult circumstances. And I say difficult because it's difficult to predict the future. It's difficult to know exactly how any request that they're given will actually score. It's a very complicated process. They have to build models. It takes a long time to build a model. It takes a long time to know what goes into the model. And so I want to just make it very clear here today, for anyone listening, that repeal of the health care law will actually increase the deficit by about $240-some billion over 10 years and actually increase the deficit by over $1 trillion in the next 10 years. That's what the Congressional Budget Office says. That's the organization that all members of Congress must live by. Different members of Congress might have different points of view. They may belong to some different organization. It's very liberal, it's very conservative, has an axe to grind. They could come up with some other figure, but that's my point. They usually have an axe to grind. They've usually got a bias that they want to perpetuate. But it's the one arbiter which is in the middle, this is professional, the one organization that nobody has ever accused of being partisan or being unprofessional is the Congressional Budget Office. And let me just say it again. They conclude, they've written letters to all of us in the Congress that essentially repeal would add about $250 million to the deficit over 10 years. Add to the deficit. That's what repeal would do. That's what the independent organization says. And it will add to the deficit over $1 trillion in the next 10 years. So, I mean, I think that should be in the argument right there, because it is the one neutral, professional organization that's looked at this. Other organizations can have their views. They can have their points of view. But the one that's professional is the Congressional Budget Office. That's what they rule. We have to go by those numbers anyway in passing legislation here. Let's stop that. Should be the end of the argument. That has been settled. That's what the effect of repeal would be. That's it. Okay. And anybody who says the contrary knows that he or she is spouting off numbers that are not the Congressional Budget Office, but some other organization. I don't know who they are. They may be the Heritage Organization. They may be some other organization. Who knows what they are? But it's not the Congressional Budget Office. And first of all, they're not neutral. They're not unbiased. And second, we can't go by those numbers anyway under the rules of the Senate. So it's kind of silly, frankly. They may be scare tactics. So that is one of the scare tactics that's used, Madam President, on this floor to try to score political points, because it is inaccurate. It is just plain simply inaccurate. Now, a couple other points. What do we spend on health care in America today, altogether? We spend about $2.5 trillion a year in health care. We Americans do. About half of that's public, that is Medicare, Medicaid, children's health insurance. About half of that's private. It's the commercial insurance industry. That's the American way. That was the division before health care reform was enacted. What's the division after health care reform was enacted? It's about the same. It's about 50-50. So this is no government takeover. This is no government takeover. It's still about the same. Maybe a percentage point or so different, I don't know. But it's basically, it's the same. There's no government takeover here. Half of it is still private commercial insurance, as it always has been. We also, in America, spend much more per person on health care than the next most expensive country. I don't know the exact number. I think it's 50-60% more per person on health care than the next most expensive country. And we're not 50-60% more healthy per person than the next most expensive country per person. In fact, all the international health care data rank us pretty low. We're not number one. We're not number two in health care. We're way down there. I've seen statistics, I haven't looked at it recently, between maybe 14th and 20th in terms of health. Our infant mortality rate's much higher than many, many countries. Our death rate's higher than many, many countries. I don't know about our diabetes rate. I would expect that's probably high compared with other countries, maybe cardiac and other chronic care is high compared to other countries, but we're not number one in terms of health care. We are number one in per capita cost of health care. So I would think we should begin to reduce the rate of growth of health care expenditures in our country. And that's what this legislation does. It starts to reduce the rate of growth of health care costs in this country. That's probably why the Congressional Budget Office reaches its conclusion. It actually reduces the deficit by $250 billion over 10. It's probably why the Congressional Budget Office says that it reduces the deficit over $1 trillion over the next 10 years. And it's probably why the Congressional Budget Office also said, compared with prior law, I think it's 90% of Americans' premiums will be lower. 90% of people's premiums will be lower. Again, that's the Congressional Budget Office. That's a neutral organization. They do the best they can. They're professional. Some members of Congress criticize them because they don't come up with conclusions they like. Other members of Congress criticize the CBO because the CBO doesn't come up with conclusions that they like. You know, it's tough what they do, but they've always been praised for doing the best job they can, and they've never been criticized for any partisanship or unprofessionalism. They're a very good outfit, I might add. I've had my problems with the head of CBO, Mr. Elmendorf. I've talked to him many times on the phone. And so most of the time it's, can't you get your numbers to us more quickly? Why does it take so long? And he does his best. He's very professional. He says, Senator, I'm just doing the best I can. And I know that he is. But still I'm a little frustrated, but I know that he is. And I think he does a pretty decent job. Now you might ask, why are American health care costs so high? Why is that? Why are American health care costs so high? Well, Madam President, there are a lot of reasons for that. Essentially, it's waste. It comes down to waste. There's a lot of waste in the American system. And this legislation, among other things, is designed to root out a lot of the waste. What is some of the waste? I'm not going to go into great detail here, but I am struck with an article written by Dr. Gawande, June 1, I think it was, 2009, in the New Yorker magazine, comparing El Paso, Texas with McCollum, Texas. And what conclusion did he reach? This is an article that many in the healthcare industry cite, because most people think this fellow kind of got the nub of the issue right. Healthcare costs in El Paso are about half per person as our healthcare costs in McCollum, Texas. They're both border towns, so it's been adjusted for immigration and so forth. And the outcomes in El Paso are higher. People do better in El Paso than they do in McAllen, Texas. Well, why, one might ask? And the basic conclusion of this article is it's because of the way we in America reimburse doctors and hospitals and providers. It's a way which allows a culture in a community to spend a lot of dollars on health care if it wants to. And it's a way that allows a culture in a community to spend fewer dollars and focus more on the patient if it wants to. That's the culture of the community. And that's because we pay, in America, we pay providers, doctors, hospitals, the pharmaceutical companies, medical equipment manufacturers, so forth, on the basis of quantity and volume, not on the basis of quality. So there's a bias in the system. Docs want to do the right thing, but there's a bias for a doctor to order an extra procedure. There's a bias to order an extra drug for this or that. There's a bias to get this new equipment. And I might say, too, it's awfully technical, but when we reimburse hospitals that are something called DRGs, the DRG it's according to procedure in a hospital, does not include the medical equipment. So there's no real fix on what's the cost of that medical equipment. So the medical equipment manufacturers can charge virtually what they want, and they charge a lot. We've heard lots of stories. You can go to Walmart and get the same, little small whatever it is for about a tenth the cost that a hospital is going to charge you, and it's because it's the providers put that to the DRGs. That's an example of a lot of the waste that occurs in our system. Give me another example. I think there are excessive procedures in America. You could do too much with anecdotes, but this is just one that I think gives some indication of one of the problems we face in America. I know a doctor, he's a neurosurgeon, he's very, very reputable, it's very good. And he said to me, he said, Max, there's another neurosurgeon group that wanted me to join them. They wanted me to join their practice. So I would talk to them. And we talked a while. I have my own practice. They've got their practice. And after a while, the negotiations kind of cooled off a little bit. Well, why? And it turned out that the group that was seeking to have my friend join them did an audit. They did an audit on my friend's neurosurgical practice. And it was that audit which kind of cooled the ardor of the group in having my friend join them. Why? Well, the group said, our hit rate is 2 to 1. Your hit rate is only 20 to 1. Those are exact words they used, hit rate. What does that mean? That means in the practice of the several surgeons, neurosurgeons, for every 2 patients they see, they perform 1 procedure. They have a hit rate of 2 to 1. My friend's hit rate is 20 to 1. For every 20 patients he sees, he performs a procedure. Those docs in that group love procedures. They want to do everything under the sun. You got a back pain, it's a procedure, it's an operation, all that. Whereas often you don't have to have the most expensive procedures. But our system in America, because it compensates docs and hospitals on the basis of volume and quantity, has a bias toward excessive procedures. And that's one reason we have waste in America today. Nobody disputes that. It's one reason we have waste in America today. Something else is very interesting. There's an outfit called the Dartmouth Study. It's called the Atlas Study. A guy named Jack Wenberg. This is a few years ago. He looked at health care costs across the country. And what did he conclude? And by the way, this study has not been refuted in any significant way over the years. He concluded, basically, and I'm exaggerating now, but if a person lives, say, in a wheat belt state, say Montana, Dakotas, or Northern Plains state, that person's health care costs per person is roughly 1/2 of what it would be if that person were to live in a Sun Belt state. Miami, Denver, or Los Angeles, Phoenix, Dallas. And the outcomes in the wheat belt states versus the sun belt states is better. People have better outcomes. That is, they're cured better and faster than our people in the sun belt states where the cost is twice as much per person. Well, you might ask, well, why is that? And the reason is because, basically, it's supply-driven. That is, in the South, there are a lot more docs per person. There are a lot more hospitals per person. People like to live in the South. They like the sunshine and the weather. And when you got more docs and you got more hospitals, that is supply-driven. That tends to push up costs because those doctors and those hospitals, they want to do things. They want to order procedures for their patients to make them worthwhile. And that's what happens. Now, most docs around the country, including the South, are really good docs. They want to do the right thing. But I can tell you, I've run into individuals. One cardiac surgeon, he talked to me. I couldn't believe it. He is very upset. He's only getting paid $2 million a year. And basically, he just had people come in, just rotate people in his office, do more cardiac stuff, more cardiac. He's upset he's only getting paid $2 million a year as a cataract. He's a cataract ophthalmologist. And so this health care bill is trying to address that basic problem. And it's called health care delivery reform. We're going to move slowly toward reimbursing docs and hospitals a little bit more on the basis of quality as opposed to quantity. And it's hard to measure quality. How do you measure quality? It is hard, very hard. But there's some provisions in this legislation which have been criticized by people, I think unfairly, designed to help us, both the doctor and the patient, have a better idea of what the right procedure is and how to get the highest quality of Medicare. That's what it's designed to do. Now, there are lots of names. There's bundling, there's ACOs, there's all kinds of things. But that's the whole purpose of it. And key here is this. It's not at all intended to tell the doctor or the patient what to do, as has been claimed. Not at all, that at all. Rather, it's just the opposite. It's to help the doctor and the hospital have better, more information so the doctor and the patient can decide for themselves what procedure should next be enacted or not. It's more information to the patient, it's more information to the doctor, so the patient and the doctor can make their own decision. There are implications by some on the other side of the aisle that this legislation destroys or significantly undermines the doctor-patient relationship. Not a whit of truth to it. It's just the opposite. It helps with information to the docs, information to the hospitals, to the doctors and the patients. They're in a lot better position to know what they should and should not do. You talk to a lot of doctors. They want to learn more. Right now, the drug rep comes in their office and peddles this drug. And doc wonders, gee, is this the right drug or not? And what we're trying to do here is get a little more objective source of information so the doctor and the hospital and the patient have better information. Let me go back to an earlier point. I mentioned that health care costs, according to the Dartmouth study, are much lower in the northern High Plains states compared with the southern states. The Congressional Budget Office, now people may not like this because it's the Congressional Budget Office. People on one side of the aisle may not like it because it's the Congressional Budget Office. But they concluded that if the entire country's health care system were applied nationwide in the way that is applied in the wheat belt states, that is Montana and other northern High Plains states, the cost of health care in America would be reduced by 29%. 29%. And remember, the outcomes in the wheat belt states are better than are the outcomes in the Sun Belt states. Well, as I said earlier, we spend $2.5 trillion a year in health care. 30%, $2.5 trillion, that's a lot of money. What's that? North of $800 billion a year. No, I don't stand here to say we're going to save all that money. What I am saying is that's some indication of some of the waste that occurs in the current system. Now others will say, well, there's waste because too many docs have to practice defensive medicine. I don't deny that. I don't deny that. I think that too many docs do have to practice defensive medicine, and that's got to be addressed. But that's waste. That, by and large, is waste, and it must be addressed. Madam President, I know other senators wish to speak, but there's a couple other points here that I want to make. Pre-existing conditions is really a big deal. In my state of Montana, about 425,000 people have pre-existing conditions. That's near half the population. That means that without health care reform, most of those 525,000 would not get quality health insurance. They would not get health insurance, certainly not quality health insurance. They may get it, but they have to pay so much in premiums to get coverage. This legislation moves us toward that day where a health insurance company cannot deny coverage based on pre-existing conditions. We've already done it for kids. We've got a pool for kids. And in a couple of years, all Americans will be able to get quality health insurance. That is, they will not be denied coverage based upon pre-existing conditions. And what is the consequence today of denial based on pre-existing conditions? You know, part of it is people don't have health insurance. But also it's this. In my state of Montana, this is true in all states, a lot of people go to the emergency room. You know, they go to the doctor, and they get hit by a truck, or they get cancer, or something happens to them, and they don't have insurance. They don't have insurance, what are they going to do? Well, I guess you go to the ER. That's what you do. You go to the ER, you got a good ER doc. He or she's really good, takes care of you. And we're going to see a doc, another doc, hospital bill. You can't pay a hospital bill because you don't have insurance. What happens? Well, you get the care, but the cost of the doc and the ER doc and the other physicians and the drugs in the hospital, somebody's got to pay for it. So who pays? All the rest of us who have health insurance. We pay. It's all transferred on the rest of us who pay. So our bills, our health care bills, our premiums are higher today because of the people who don't have health insurance. It's called uncompensated care. In Montana, the bill is about $2,100 a month. That is, in Montana, excuse me, a year. Premiums in Montana are $2,100 of a family premium, health care premium in Montana is due to uncompensated care. And so if people had health insurance, you know, the whole country had health insurance, then we wouldn't have that transfer cost, all the rest of us who would have to pay for it. Well, then you may say, well, gee, how are you going to get those other people having health insurance? That's the question. That's one of the questions that comes up in this bill. But I think we should have an honest discussion about that. How do you do it? Well, this bill says two things. People must have health insurance. They can do it two ways. If they're poor, they can go to Medicaid. Medicaid is expanded a bit. Then when there's issues like, well, gee, doesn't that cost too much? Aren't states having to pay big bills and so forth? And the answer to that is, well, there's no increase in bills to the states for how many years? 3 years. For 3 years. And then the match is reduced from 100% down to 90%. But that's after several years, which is much higher than it currently is, as much higher federal dollars than is for other Medicaid. We could have that discussion, and let's figure out ways to help states that legitimately need help. But still, it's more insurance for people, which is good, because those people, when they get health care, those bills aren't passed on to all the rest of us. The other way, clearly, is to give assistance to people who cannot afford health insurance. And it's through a rebate in the tax code. And that's where a lot of the money is. That's where a lot of the money goes. But it's clear that some people have too much money to qualify for Medicaid, but not enough to buy health insurance, are going to need some assistance. So this legislation is designed to help those people get assistance, and the wealthier they are, the less assistance they get. Now, some say that's why this bill costs so much. I think it's important to remind people here that according to the Congressional Budget Office, again, the neutral group that we trust, nobody questions their integrity, says this bill doesn't cost a thin dime. A lot of people like to say, oh, it's $1 trillion bill. Well, it does cost $1 trillion, but it raises $1 trillion. So on that basis, it doesn't cost anything. And the dollars are raised through the rates in which is reduced. The rates we pay for providers are cut back a little bit. There's also some fees on some of the providers. That is true. That is true. And that's how this bill is paid for. But let's remember, almost all those providers, all those people who are paying a little higher taxes, and all those groups whose reimbursement rate's a little lower, favored the bill. They're in favor of it. Now, you might ask, why in the world do they favor this bill? And the answer is because more people have insurance. And if more people have insurance, their margins might drop a little, but their volume will increase. They can make money. They figure they're going to make money under health insurance reform. Hospitals, pharmaceuticals, medical equipment manufacturers, most insurance industry, you name it. They think they can make some money. So I don't want to take too much time with my colleagues here, although I do have one other point, and that's Medicare. It has stayed on this floor, well, this hurts Medicare. Takes money out of Medicare. That's a red herring, Madam President. Red herring in the sense that somebody says thing on the face of it is true, but it's irrelevant to the main point. It is true that the reimbursement rates to providers is a little lower. But it is also true that this legislation extends the life of the Medicare Trust Fund by about 10 years.
12.
I'm corrected, Madam President, by 12 years. The trust fund under this legislation is extended. The life of the trust fund is extended by 12 years compared to what it would be before this law was enacted. Well, some people want to repeal that. Oh, they want to cut back the life of the Medicare Trust Fund. What else do they want to cut back with repeal? Repeal gives many seniors, 4 million Americans, I think is the number, a drug benefit and that donut hole, $250 a year. In my state, Montana, it's 9,000 Montanans. And after a period of time, that donut hole will be closed. So seniors won't have to pay for excessive costs in prescription drugs. Well, repeal would repeal that. Repeal would say, uh-oh, all you seniors, 400 million seniors, 4 million seniors, we're going to send you a $250 bill. We want you to pay $250, in effect, of drugs. We don't want you to get any break. That's what repeal does. That's what repeal does. I don't think Americans want health care reform repealed. Certainly those 4 million seniors don't want it repealed. And, well, I've got a lot to say here. I'll finish up here. But all I ask is this, Madam President. I ask, and we're going to have this debate, regrettably, for about a year, until the Supreme Court finally decides. I ask that we all stick with the facts. We stick with the facts and don't indulge in histrionics, scare tactics, and so forth. Just get the facts, ma'am, because the facts generally control. You can't change facts. So the fact is, what does CBO say? There are lots of facts here. And I just urge us to stick with the facts. We can argue what they may mean or not mean, but let's stick with the facts. Let's not manufacture facts. You can't manufacture facts and have a good faith debate. And I assume that this is going to be a good faith debate. So let's stick with the facts. And when we do, one small thing here, and I will say this. There's a person who once stood here years ago in the United States Senate. It was Mike Mansfield from Montana. He was the majority leader in the United States Senate for 17 years. No other leader served as many years as Mike Mansfield. And I ran across a statement by him, which he gave in 1989 to a bunch of wide-eyed students. And I can't remember exactly what he said, but the main point of it is this, you know, he's a real reasonable guy, revered in Montana. It's in all efforts to be constructive, you have to listen. You know, listen very well, very closely to the other person's point of view. He went on to say, says, you're not always right, and they're not always wrong. And the more you listen, and the more they listen, you'll see where you're not right, and you'll see where they're not wrong. You'll also see where you're right and they're wrong. But you got to listen to try to find that common ground of where somebody's right and somebody's not right, but in an objective sense of the term. Then use that information constructively and with knowledge and with good faith. And I just ask all of us to do just that. Thank you, Mr. President. Mr. President, I've got 2 requests I forgot to give. I ask consent that the following staff, if finance committee be allowed on the Senate floor during the duration of the debate on the FAA Transportation Modernization and Safety Improvement Act, are Ellen Montz, Lisa Yen, Jonathan Jaffrey, Kevin Ward, Shannon Olberding, Jack McGillis, Eric Roberts, Brian Ellison, Michael Grant, Andrew Fishburne, Matthew McFeely, Jessica Kamarua. Also have 3 unanimous consent requests for committees to meet during today's session of the Senate, and they have approval of the majority and minority leaders, and ask consent that these requests be agreed to and the requests be printed in the record.
Without objection.
I yield the floor.
Mr. President.
Senator from South Carolina.
Mr. President, I ask unanimous consent at the conclusion of my remarks that Senator Johans be allowed to speak.
Without objection.
Thank you, Mr. President. I think any American who just heard the explanation of what Obamacare does for Americans will realize that the complexity of the health care system, the importance of the patient-physician relationship cannot be managed from the federal level. I had some difficulty really determining exactly what was being said there. But I do want to talk about health care. But before I do, I need to make a couple of comments about the FAA perimeter rule that is part of the discussion that the health care amendment will be attached to. The perimeter rule is an antiquated policy adopted in the 1960s that prohibits aircrafts flying in and out of Reagan National originating or departing anywhere beyond an arbitrary 1,250-mile limit. Congress imposed this limitation 5 decades ago in an attempt to help the Dulles Airport in Virginia when it was first being opened. The rationale was the best way to ensure growth at Dulles was to limit the growth at National Airport. And so by federal fiat, a short-haul airport was created at National and a long-haul airport created at Dulles. At the time, Congress assumed government could create an efficient aviation system and the government would best decide prices, routes, and schedules. The perimeter rule is outdated today. Americans out west want to fly directly into downtown D.C. Travelers from downtown D.C. do not want to go to Dulles to fly to the West Coast. The government needs to do away with the perimeter rule, just like it did with the regulation of aviation system. Dulles is now an international any other airport in the country. The federal transportation policy should be based on competition and consumer need, but the existing perimeter rule is denying consumers choice in air travel and frustrating market forces that could accommodate these consumers. Consumer choices in the markets should govern the schedules and flights out of Reagan National, not the federal government. I would ask unanimous consent that my remarks regarding Reagan National Airport and my forthcoming remarks on health care policy appear as 2 distinct sections in the record.
Without objection.
Thank you, Mr. President. This week, President Obama gave a speech about health care. Or actually, I guess it was last week now. The speech was at a fancy hotel here in Washington, and he told jokes to make everyone laugh and sad stories to endear his audience further to his cause. The President said, as he has many times before, his law will lower the cost of health care. President Obama knows how to give a good speech, and he also knows how to tell it like it isn't. While President Obama was busy selling his policies on the stump, others were busy analyzing the real effects of his health care law. It's not limiting cost. Now, we heard some of the figures given by the Democrats here from the Congressional Budget Office, but we have to expose that they're really playing with numbers. If you tell the Congressional Budget Office to take $500 billion from Medicare that's already bankrupt and can't pay doctors to see patients, but you take $500 billion and call that savings that are created by Obamacare, that's part of where they get their money. The other part is to raise taxes on a lot of health care products and services and call that new revenue created by Obamacare. Any thinking American knows that you can't create a $1 trillion new health care entitlement, and it actually saves us money. When the Congressional Budget Office looks at our whole health care spending at the federal level, it tells us, without all these funny assumptions, that the federal spending on health care is going to double over the next 10 years. That's not saving us money. And this is the same office that found, without these funny assumptions, that Obamacare would cause premiums to rise an average of $2,100 per year for families in the individual market. That's telling it like it is. It wasn't that long ago that some of the country's largest insurance carriers sent a letter to their enrollees warning them that Obamacare was going to drive up the cost of premiums. They told it like it is. The Obama administration didn't want this information to get out. So the Department of Health and Human Services sent a letter back to the insurance carriers saying their claims were not true, and HHS would have zero tolerance for this type of misinformation. They want to keep on telling it like it isn't. Richard Foster, the chief actuary for Medicare and independent economic expert, recently testified before the House Budget Committee. He was asked if it was true or false that Obama's health care bill would lower cost. Just a true or false question. He said, I would say false more than true. He told it like it is. False more than true is a very polite way of saying no, it won't lower health care costs. That claim is false. President Obama also promised that if you would like to keep your health care plan, you can keep it. Richard Foster was also asked if those who like their health care plans would be able to keep their coverage. He said, not true in all cases. It certainly isn't true if you live in one of the 34 states where health insurers stopped selling child-only policies. And it's not true if you live in Colorado and have Aetna insurance. Politico reported Monday evening that the health insurance carrier was pulling out of the individual markets. And many Americans will lose their health plans with Obamacare. But you can keep your health care plan if your union or company got one of the 733 Obamacare waivers so far. The waivers cover almost 2.2 million people. You can get your health care, or you can keep it, if you're a member of the 6 chapters of the Service Employees International Union who got waivers and whose political action committee spent more than $27 million helping Barack Obama get elected. Or if you're one of the 8,000 members of the United Food and Commercial Workers Union that got waivers, their PAC has spent millions helping Barack Obama and Democrats get elected. These are the unions that supported cramming Obamacare down the throat of the rest of Americans. Even though labor unions represent less than 7% of the private workforce, they have received 40% of the waivers. They don't want the health care they want other Americans to have to accept. Most Americans don't play these political games. They don't have lobbyists and PACs. but I think they should all get a waiver too. I think we should name this repeal bill that we will vote on today the Great American Waiver. Every Republican in the Senate is committed to repealing this bill. Every American gets a waiver when we repeal this bill. Soon we will have a vote to repeal Obamacare here in the Senate. I strongly urge my colleagues to follow the House in repealing it and returning it to the sender in the White House. I'm aware the President currently in the White House might want to veto our repeal. There is, however, going to be a presidential election in 2012, and this health care bill, this health care law, is going to be a defining issue in that election. 2012 is 2 years before the law will fully be implemented. We can get a supermajority to overturn his veto in the next election, or we can get a new president who will support its repeal. I think both outcomes are possible. Let us all go on record now showing where we stand. I suspect there are some Democrats who might want to repeal this law before voters repeal them. The question is, do they have the courage to break with their party? For now, the President would like us to think his law can be fixed by modifying it slightly. It can't be fixed. Trying to fix it with a few good ideas is like pouring a few glasses of fresh water into a polluted river. Obamacare cannot be fixed by tinkering with its provisions because the basic premise is flawed. This law is actively creating a government control system that relies on high taxes, less choices, and bureaucrats making health care decisions for Americans. This is exactly what we are opposed to and why we insist on a full repeal. A recent analysis by the Center for Health Transformation found it will give the Secretary of Health and Human Services 1,968 new powers. Last year, the Joint Economic Committee found that Obamacare created 159 new federal programs and bureaucracies to make decisions that should be made between patients and their doctors. If the Democrats and federal bureaucrats are permitted to control our health care system, our tax code will look simple by comparison. Worst of all, in the rush to pass this legislation, none of its proponents cared if it was unconstitutional or not. They weren't going to let the Constitution get in the way of their health care takeover. Even now, when asked about the constitutionality of the bill, Secretary of Health and Human Services has said, "I'm leaving those arguments to our legal team from the Department of Justice." So far, their legal team is losing. Two judges have told it like it is. Obamacare has been ruled unconstitutional by judges in Virginia and Florida. The Virginia court held that the individual mandate requiring every American to purchase government-approved health insurance was unconstitutional. The Florida court ruled the entire bill was unconstitutional because of the individual mandate included in it. In his decision handed down on Monday, Florida's District Judge Roger Vinson compared the law to a finely crafted watch in which one of the pieces is defective and must be removed. But what happens to Obamacare when you remove that one piece, which is clearly unconstitutional? The rest of the law falls to pieces. As the judge might say, the watch won't work. Vinson wrote, "I must conclude that the individual mandate and the remaining provisions are all inextricably bound together in purpose and must stand or fall as a single unit. An unconstitutional law that touches the most important personal decisions Americans ever make must not stand. We must repeal the bill in its entirety, because at the very heart of it, which makes all the other parts work, that very heart, that individual mandate, violates the highest law of our land. And it's already failing Americans. Health care costs and premiums are going up, despite the false assumptions we hear on the other side. Choices in consumer control over the health care system are going down. By continuing to follow a failing plan, the government is planning to allow our health care system to fail. Obama's broken promises are going to create a broken future for our country. If we do not fully repeal this bill, it's going to add nearly $500 billion in new health care taxes and raise the federal budget deficit by more than $500 billion in the next 10 years and nearly $1.5 trillion in the next decade. Yet the President says that this is going to save us money. We know this so-called Affordable Health Care Act for America does not live up to its label. We must repeal this bill and implement common-sense solutions that will lower the cost of health care for consumers and make health insurance available to everyone, even with pre-existing conditions. We should allow Americans to choose affordable plans across state lines, and we should end frivolous lawsuits that drive up costs and give equitable tax treatment to those who don't get insurance from their employer. Obamacare does none of this. The facts and figures tell it like it is. President Obama tells it like it isn't. It's time for Congress to tell it like it is and repeal Obamacare. Thank you, Mr. President. I yield the floor.